Good morning. How are you recovering today?
Ronald Golby has just had potentially life-saving surgery to repair valves in his heart. For the past 7 years, he's been living with the risk of blood clots and a stroke. Ronald was worried NHS strikes and winter pressures might delay his procedure. And although he suffered one cancellation, he says public expectations of the NHS need to be lowered.
People expecting it to happen tomorrow. You know, it's just not, it's not on. It just doesn't happen. It can't be expected to happen. And I think you have to accept that the NHS is underfunded, you know, that impacts on waiting times.
The waiting list for elective care has stabilised in recent months, but that's of little comfort to patients, with 7.6 million procedures and operations yet to be carried out, impacted by blockages in the hospital system.
Patient flow through the hospital is a problem throughout the NHS. It's not just the huge numbers of people arriving on an emergency basis, but also challenges in discharging vulnerable patients.
January has been one of the busiest months on record for A&E attendances and ambulance call-outs.
The challenges are always, regardless of the time of year, to see the sickest patients first, appropriate timely care for people, and to deliver the sort of service that we came into medicine to deliver, which isn't people waiting in ambulances, it isn't people waiting for hours in the waiting room.
But those waits are the reality. 2023 saw the longest waits for cancer treatment on record. NHS England's own target of 95% of A&E patients being seen within 4 hours has not been met for 8 years. This winter, the NHS was saved from a strong surge of flu and COVID cases at the same time as industrial action. But waiting times for care across the service show it still struggled to meet demand. More people went to A&E last month than any January before, some 2.2 million.
This has been as challenging a winter as last year, and indeed we've had some days in the last couple of weeks where we've had more challenges in terms of our emergency care and ambulance offloads than we've had over the previous few years.
Ronald should be home by the weekend, and he's extremely grateful for the care he's received. But junior doctors will soon be balloted for further strike action. The pressure on the NHS will not ease anytime soon. Ashish Joshi, Sky News, at the New Cross Hospital in Wolverhampton.